Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
The NIH pictures, but I don't know if they showed up through my little camera here. So I made a little file of them just to share with the group.
So you want to share that with us now, or how do you want to do it?
Yeah, I can do that. Let's see.
Yeah.
I see it. Congratulations. I did get that.
It's amazing.
Mhm.
Yeah.
Wow. Wow. Excellent.
Yes.
You decided to wear my jacket that I have on that day.
And they gave me a t-shirt. This is a t-shirt.
Oh, really?
I've gotten like 20 t-shirts from them. And they gave me a cake. That's my cake. Chocolate cake.
Did you eat it?
Well, I had 2 slices and then it disappeared. I don't know what happened. Next.
Congratulations. That's exciting.
And hold that cake there for a minute, John.
Hold it.
Yeah, that looks like my dad's cake when he turned 100 years old.
Really?
Congratulations, John, on your 100.
Okay.
And this
Oh, and this is it. This is it. Oh. Great.
And we, like you didn't share about Saturday. You want to tell them about Saturday?
That's what I was talking about. How you demonstrated your skills on the timpani, which was awesome. It was an awesome program that we put together. It was a program that is actually celebrating Good Friday, and they had a number of awesome soloists and musicians who participated. Actually, you were the guest timpani, and then there were some also additional soloists, singers who participated as well. But it was an awesome program. But it was really made particularly special by Buchanan's participation. That's my side of it. You had another story to tell?
I have another side too. That was the first time performing in person with Dr. Callender in over 2 years, right?
That's right. That's right. Yeah, it was great. Though it was quite awesome because and it was very moving performances by all of the soloists and Everett Williams and Steve Keys also performed as well. But it was a very moving production, which will be live streamed on I think, what is the date? April of 15th?
April the 15th, yes.
Yeah.
Probably at 12 noon. And that was my first virtual performance. So I'd never done a virtual performance before. So
Really? Oh, okay.
it worked out. But it was like in a recording studio. So
Yeah.
I've been there a lot of times, but not the video. So that was really great.
Okay, so is this the first article?
Yes, this is the
Okay.
first.
And yoga as medicine, and this is interesting to share. Those of us, there's some of us on this group that participate with yoga, which has been many articles recently demonstrating the way in which yoga has health benefits, the many ways in which yoga has health benefits. And this is just to show how it works and how it affects so many different parts of the body. And it's actually something that's relatively simple, but yet it has such wide-reaching effects. And the fact that it might improve your arthritis, which all of us get as we age, makes it even more desirable. Yeah. It has so many different benefits that it's something that is old as the hills, but yet invaluable. How many of you practice yoga in the school?
I do. Kevin
Not
had.
regular. I used to, and I did enjoy it, but I haven't in a while. So I need to get back to it.
One of the things that I noticed in the morning when I come down the stairs, I'd hear a breakfast cereal, Rice Krispies. You remember Rice Krispies? Snap, crackle,
Yes.
and pop. That
Mhm.
was my knees.
Right.
But I don't know, since I've been doing yoga now for over 2 years. And at first it was just once a week. Now I do it 4 times a week. And it really has benefits. Also, I don't know, did they mention it helps you to sleep at night, just the focus on the breath helps me to get to sleep.
They don't mention that, but that's an interesting aspect of it. Because we take it for granted that you sleep at night.
I wonder how old yoga is.
I don't know. You have any idea, John, how old yoga?
Somebody said 2,000 years. Been around. It's been around a long time. I don't know if that's fact. I wouldn't quote that, but
It sounds about right.
Okay, let's go
Yoga
to the next.
introduced by the Asian community?
What's that?
Was yoga introduced by the Asian community?
I don't know. Do you know, John?
I think it's like out of Buddhism, India.
India.
Yeah,
That
probably.
makes sense.
Yeah, Sanskrit is where the names of the moves come from. The names of the positions and
This is an article that we have in many ways talked about almost all the time. But anyway, this is another one that talks about the 5 tips for a healthy diet, and it's not possible to over emphasize the importance of choosing the right foods, as they say here. And this talks also about the portions and sizes, and emphasize, as every article does, the importance of fruits, vegetables, and even talking about lean meats, which you rarely hear them talk about. And this is something that I've never seen before. No food is bad food. It reminds me of the scripture in the Bible where God talks to Paul, and I think it's Paul, and says, no, or is it Peter? One of the apostles anyway, and says,
Peter.
Peter, yeah, do not call anything that I've made unclean. Although in the Old Testament, there were foods that were unclean. But anyway, Sodom says no food is bad food. It's actually the preservatives and other things that make some of the food not so good. And you can't have too many vegetables in your diet, although we sometimes forget that. But that's the area that we could always include more vegetables. Portion control is so important to understand that the portion, the size of the plate you have is what matters, in addition to what's on the plate. But how many portions do you have? And they talk about do not give in to gimmicks. And in my opinion, a lot of these supplemental vitamins and diets are gimmicks. But one's man's gimmick is another man's pride. So, but I guess what it's saying is stick to the straightforward stuff, and wonder about the miracle diets and supplements and vitamins that people talk about. Any other thoughts about eating correctly?
My thing is about the supplements. I fell, victim to all those miracle supplements that you can take or whatever, and you don't realize later on what strain it puts on your liver and everything. And and I bought some turmeric the other day, and it was like, this great herb to take that was supposed to a good liver cleanser. But then you look into it and you go, unless you have gallstones and cirrhosis, it's like, whoop, got the receipt. Take this one back. And my nutritionist said you should be able to get most of your vitamins from your food.
Yeah.
But I did go have blood drawn the other day, and I know I have a deficiency in vitamin D, and I'm waiting for other results too.
Yeah, many of us do have vitamin D deficiency.
Every time I see my doctor, she always asks me if I'm taking any supplements, every visit. And I tell her no, but now I can understand why she asked that.
Right.
Yeah.
She asked me if I'm taking any supplements or any.
Yeah, sometimes people take supplements and herbs that, and so you need to know that so you can look at the bottle and find out what's actually in them if they have a report of it.
It makes a difference. I've had a problem with vitamin D, my levels being low. And I found out the average level is between 30 and 100. Mine stayed at 20. And I always took citric out D. And then the doctor suggested that I take additional vitamin D. And finally, and this is years, I got to 30. And Dr. Callender, I guess that's not great, but it's within range. So it does help sometimes to take a supplement. And the doctor did suggest it.
Yeah, well, and in many ways, that's different because you have a vitamin deficiency, in which case you have to take, you must take vitamins.
Right.
But sometimes people take supplements and they don't have deficiencies. So
Yeah.
When I had my thyroid removed, my calcium receptors were damaged. So I have to take additional calcium. And that's a problem to me because it causes other problems. So, but I do it, but I have to take a lot of calcium. I can't retain it. So I have to take it every day.
Right, and that's different when you have a
Mhm,
deficiency, right?
mhm.
Okay, we can go to the next one if there aren't any other comments.
Yeah, I had a question. Kevin mentioned turmeric. You know anything about turmeric?
Yeah, that's actually suggested as a product that decreases the incidence of Alzheimer's and decreases the incidence of cancers. And it's very much like the Indian products that are so hot in the food. But it's generally, as the C says, if you don't have cirrhosis or gallstones, some people recommend it.
All righty, thanks.
This is an article that is disconcerting to some extent, because if you're a diabetic, you really don't have much choice, because sugar is a no-no, and so you almost have to take artificial sweeteners. And this article looks at the artificial sweeteners and identifies that there is a possibility that there is a association with cancer. And so that's why the article was done, to see if this is really true. And although every study has limitations, as this one does, the basic concern is that there was a slight high risk for breast cancer and obesity-related cancers. So they do not support the use of artificial sweeteners as alternatives to sugar. But what they don't suggest, though, is if not this, then what? If you're a diabetic, because it's like the diabetic does not have any alternative, and so although the risk for cancer is not huge, it's still a risk, and something that any diabetics among you who use artificial sweeteners?
I do.
I do.
And I think many people are in a situation where they have to. And I think one of the things that you ought to do, if that's the case, is that you just try to avoid those other things that increase the risk of cancer, like red meat and other things.
You said no.
Go ahead, Betty, didn't hear what you said.
No, I'm telling my husband he uses equal. He's a diabetic.
Oh, okay.
Said no at first, but I told him he uses equal.
Yeah. Any other comments or thoughts about that for any of those?
I'm not a diabetic, but I use Splenda for everything that needs a sweetener. I guess I should change my habits. Yeah.
Well,
There's one called stevia. There's one called stevia that's supposed to be pretty good.
yeah, it's interesting. They don't offer a substitute because most of the artificial sweeteners fall into the same category.
Mm.
But I would then suggest that you make sure that you recognize those other products that increase the risk of cancer and avoid them, like minimizing the red meat and those other things that are associated with increased cancer.
I remember a long time ago, my grandfather used to use these little pills for sweeteners, saccharin, and then they said that caused cancer.
Yeah, and just about all the artificial sweeteners have a slight increase in the incidence of cancer. And But if you're diabetic, you don't have much choice.
Equal. Is that right?
So this is something that when they come up with those studies, they ought to identify in the articles what those people who are forced to use artificial sweeteners might do to minimize that risk that is associated with the artificial sweeteners. This is an article that says moderate exercise offers strong shield from COVID-19. And many of the people who've had COVID who have increased their exercise in an effort to minimize the impact of COVID. And because the gyms are locked and getting out is tough for some people, it's caused a problem. But it's interesting that the data indicates that those with high physical activity did much better than those who did not have high physical activity. So the bottom line is that physical exercise is good for you, even for almost everything. And COVID is not an exception.
Dr. Callender, does that mean that it keeps you from getting COVID, or?
No, it just means that if you have COVID, that exercise minimizes the complications. Because they talk about hospitalization, ICU admission, ventilation requirement, and then of course death. So it doesn't prevent you, but it does help you to survive the COVID infection. Because of the weakness, many people with the fatigue have done away with the exercise until a week or two after the COVID. But there are those who, in spite of it, have continued their physical exercise, and they have seemed to do better than those who haven't. And this article is suggesting that this should be made clear to everybody so that they should continue exercising. Any other comments about those of you who've had COVID, who stopped exercising during the infection? Anyway, this is an interesting recommendation that comes after much of the pandemic is over. We think.
Not too sure about that.
That's correct.
I'm ready for my fourth shot.
We'll talk about that too. Yeah. Okay. Now this is an article that some of you drink. How many of you drink coffee?
I do.
I just put on a pot. I'm gonna get a cup now.
Coffee drinking may cut heart disease risk and prolong survival if you have heart attack. So that those of you who drink coffee, you say a daily intake of 2 to 3 cups is not only safe, but cardioprotective, which is news to me. I don't drink coffee, and wondered about the value of coffee. But this is an article that suggests that it opens up the heart to some extent. And so your coffee drinkers are okay. Yeah.
But it doesn't mean that you don't have to take your, you still have to take your cholesterol medicine, right?
Of course, yes. But you just can take coffee with it.
So John Tatum, did your dad drink coffee? My dad did.
Yeah, he did. Yeah.
He lived to how much? How old was he?
He was 4 days from being 102.
Woohoo!
How old was your dad, Buchanan?
97.
Oh, okay. Okay.
Uncle John's birthday is coming up.
Yeah, April 4th. Yeah.
Oh, wow. This would be 103. That would have been.
Yeah.
Well, uh, it's almost un-American to not drink coffee. So it's good to have information that makes it okay.
I like it cold sometimes.
Really?
I
The
used
only
to-
time, yeah. The only time I've ever drink it is in the wintertime when it gets cold. Then I might drink it up. Interesting how the more data you look at, the more conditions that associated with heart disease, the greater the impact the coffee has on reducing atrial fibrillation or flutter, which is common. 2 to 3 cups a day almost become mandatory, according to this article.
There is another issue though with coffee. Very few people drink black coffee. So, you put sugar, creamer, all kind of other stuff in there. I do. So that could be an issue there.
Yeah,
So you have to be careful.
that's interesting. They even have a decreased incidence of type 2 diabetes. Probably those people who don't put too much sugar in there.
Yeah, they have all these specialty coffees at places like Starbucks and Dunkin' Donut and McDonald's, all kinds of flavored coffee. But my favorite, I used to drink hazelnut until they stopped serving it at Dunkin' Donut. But I still like vanilla, French vanilla, or just plain vanilla with 1 cream in it. And that's enough sugar for me.
Well, this is a interesting article that talks about lung transplantation and enzymatic treatments that may help patients with fibrosis, pulmonary fibrosis. This is a kind of a controversial article that because pulmonary fibrosis is one of those diseases that is just about impossible to treat successfully, and so suggesting that in addition to avoiding alcohol and drug use, getting enzymatic treatments can be helpful is it's good news in some ways because nothing else really works for pulmonary fibrosis. As a matter of fact, it is not unusual to find some families in which pulmonary fibrosis, idiopathic pulmonary fibrosis is not common.
Doctor, I had a friend when I was growing up who had that, and she had to go to a special, she had to have her back, she had to have, I don't know what you call it, but they had to pat her down every day for a long time, beat her.
That's called a whipping.
No.
So it's an effort to increase the ventilation of the lungs.
And when she turned 16, they gave her a really big party, and I I went to the party, but I was wondering why they were making so much of 16, but I didn't realize she did it too long.
Didn't hear that last part, Mariella.
He didn't live too much longer after that.
Yeah, it's a tough disease. With really any treatment, and of course, what this treatment is actually what they do for lung transplants. They put this enzyme in the you breathe it, and it's supposed to help. Since nothing else helps, it's worth trying. It's interesting to see if this is going to stand the test of time. You have these things that come forth that have not yet been randomized and tested, and that's not the case for this one either. So over time, it's going to be interesting to see if these enzymatic treatments help those people who have pulmonary fibrosis, or it will only help those people lungs which are transplanted. So over time, they'll care. You see what it says at the end, important is to avoid nicotine and alcohol, and also not to be overweight, which addicts tend not to be. You know, it amazes me that still today, people still smoking. It's almost impossible to go on the street and not see somebody smoking, even though we know that smoking causes so many diseases, not only cancer, but causing clots to the legs and poor circulation and other things. But yet you still see people smoking. And then of course in Europe, it's even more of a problem. People are smoking American cigarettes. And
Nicotine is so addictive. It's so hard to quit. I smoked for 40 years. And then when I started taking care of my parents, I didn't have time to smoke. And I found out medicine called Wellbutrin. And I tried to get my doctor to give it to me, and he would give it to me because he said, you have to be depressed. So I lied and went to a psychiatrist and told him I was depressed so I could get the medicine. And it worked.
it worked, huh?
The medicine worked. And then I gave my cigarettes to my friend, and he took it. He didn't want the cigarettes, he wanted the medicine, and he quit.
Really?
But it's very, very difficult to quit.
What
And I
type
don't
of,
like the sanctimonious people who don't quit, who never smoke, the way they treat smokers. And that was part of it, because I didn't like somebody automatically almost didn't smoke. So that kind of has something to do too. So I try to be kind to people that smoke, and I tell them about Wellbutrin. But I don't, I try not to condemn them, because I know how difficult it is.
Well, it's nice to hear that sensitive aspect of it, because sometimes you're right, non-smokers can be harsh on people who reek of nicotine. Yeah.
They say kissing a smoker is like licking an ashtray.
Yeah, I've heard that.
Now, I smoked for 25 years, but I've quit now for 28 years.
How did you stop?
Cold turkey. I had I had bronchitis really, really, really bad, and
That's not cool too.
my doctor suggested that maybe I should stop smoking for a while.
Suggested, yeah.
So it happened to work.
It didn't interfere with you playing all those instruments?
No, You know, but at the end, I had very bad bronchitis, had back pains and really bad phlegm, and it was time. Oh, and also, CVS stopped selling cigarettes. I think 5 or 6 years ago. Walmart and Walgreens are going to stop selling cigarettes also.
Yeah.
It's amazing on the street, you always see these people selling individual cigarettes.
Yes.
And so it's
Boosies, that's what they call them.
The reason is because they can't afford a whole pack anymore nowadays. Those cigarettes cost $5 each.
Oh, a
Really?
pack has to be, John, a pack has to be more than that.
$10,
No, he's
$10
talking
a
about,
pack.
it's about the individual cigarette.
Yeah,
Yeah.
individual cigarettes, $5 a wop.
Oh, no.
On the street, that's what it is. Yeah. This is a disease that multiple sclerosis is a disease that's far too common. It's associated with many problems with the neurological system in terms of being able to move your muscles, so forth. And sometimes very difficult to diagnose. And so this is a new test that they identify. Although it's a test that takes a long time to process, but it's more easily diagnosed. There still is treatment for multiple sclerosis, but with steroids and other medications. And one of the problems is that it presents itself in so many different ways. With a lack of muscular, sometimes you're unable to use your muscles, and sometimes that doesn't allow you to drive, doesn't allow you to do many things that your muscles get weak, and if untreated, it may result in death. So
that's what Richard Pryor had.
yeah, right. There are many
But
that,
Callender, is it genetic, or you can't catch MS, right?
no, can't catch it. We don't really know what causes it. We just know that it occurs, and sometimes it goes away. Sometimes medication will make it go away, and then it comes back. So and there are different kinds of treatment for it. Steroid is one of the most common, but there are other ways of treating it as well.
Infusion.
Any of you have any friends who have multiple sclerosis?
I had a friend years ago that had it, and I realize now that they have come a long ways from what it used to be. She died in 92, I believe, but my niece now has it, but her symptoms, I mean, from the medicine she's taken, you can hardly detect that she even has multiple sclerosis. I don't really know what medicine she's on, but her daily activity, she's pretty good at it. But my girlfriend years ago, she ended up bedridden pretty early, and my husband's sister also had it, and she was bedridden pretty early on in her.
Yeah.
But it's much better, seemingly now, the medicines.
Yeah.
Yeah, I have a friend that has it. She's in a choir that I'm in or have, and she has good days and up days, but she keeps a positive, and every Tuesday she'll call, every other Tuesday she'll call, and she just has this good, you know, positive attitude toward it. And she tries never to complain about how multiple sclerosis is really treating her.
Okay, well. Now, this is an article that talks about something that we are familiar with, that is the lack of a vaccine response in kidney transplant recipients, indicating that somewhere around 30 to 40% of the patients don't respond in the normal fashion to the vaccine. And so they have to have a booster shot and then another booster shot. And then this article is about people who have the third booster shot. And showing that for them, the third booster shot allowed them, in many instances, to develop antibodies. And so this is important because, as we talked about before, there are many centers who will not allow you to get on the transplant list if you have not been vaccinated, because they're concerned that after you get transplanted, it will be very hard to effectively vaccinate you. And so this study shows that after the third vaccination, the antibody levels were increased in many patients. Not 100%, but it still was.
Dr. Callender,
Yes.
when would it stop? Most of us have had the third shot. Now we've been cleared and they encourage another booster. I think we resigned ourselves to the fact that it was going to become annual, like a flu shot. But it seems like every 4 months they encourage a shot.
That's correct, because the antibody levels go down. They realize that patients after 4 to 6 months are more sensitive to getting COVID because of the lowering of the antibody level. And so I think the conclusion is going to be what you had indicated, that it's going to be at least an annual booster shot. And that booster shot becomes particularly problematic to those kidney transplant recipients who have not responded. There's a significant number who have responded, but there's some who don't respond, and those they have to get an additional vaccination.
Dr. Callender, is there a reason did they find a reason that the kidney transplant?
Yes, the reason is the medication that we give to prevent rejection is the reason.
Okay.
Not only the steroids, but the other transplant medications, because tacrolimus and prednisone and some other monoclonal antibodies are given, and this knocks out the immune response.
Okay.
And so that's why.
Is there anybody on this panel had the fourth shot? Have you, Dr. Callender?
No.
I got mine yesterday.
Oh, John Buchanan, you got yours?
Yeah, there's a story too. I have a story. But I'll wait a little bit and tell you about it.
Oh, no, man, I want to know now.
I'm ready. I'm ready for the fourth shot.
I'm ready to.
Yeah, they're recommended for those over 50.
50.
I inquired about it, but nobody knows anything.
Well, it wasn't approved until this week.
Oh, so John, how did you get yours?
Yeah.
Okay, well, I'm with Kaiser, and I went online and filled out there's a survey you have to take, tell them, I think mostly how old you are, qualifies you. And I set an appointment for tomorrow, for the next day, yesterday. And I went down there, and then the nurse told me they couldn't give it to me. And she said that they were only giving it to immunocompromised patients. So she said you would have to have your doctor's approval. And luckily, I had my doctor's cell phone in my pocket. I called my doctor. My doctor sent in a referral while I was sitting there waiting in the waiting room, and I got approved. So I got it. No symptoms at all. So
And they,
Yeah.
it was 5 months after my previous one. I got my booster on October the 3rd. So October, November, December, January, February, March. 5 months is 5.5 months after. So they said after 4 months you could get it. So I said I want it now.
well, this
Thank you.
is an interesting article about alopecia.
Mhm.
I guess everybody's heard about Will Smith slapping Chris Rock after he joked about his wife's shaved head. Alopecia is something that many of us men are aware of, and some women, in which you lose your hair with patches, hair loss. And because he made a joke out of it, and his wife seemed to respond to it, Will Smith slapped him. What are your thoughts about alopecia? And being familiar with people who, now a lot of women wear wigs, so you don't know whether they have it or not.
Right.
But what are your thoughts about the slapping and also about alopecia? And they once said that you should never tell a bald man he's bald, or a blind man he can't see. When you insult somebody who's to the face, that's one thing. But when you insult somebody's mother or somebody's wife, that causes other things. And in the old days, they would challenge you to a duel. But Will Smith did a kinder thing. He just slapped him. And what are your thoughts on the alopecia per se, and whether it matters whether you're a woman or a man, or what do you think about joking about it? What are your thoughts?
My father had alopecia. It's just like with all diseases. Would you joan on somebody because they got MS or cancer, or they had a wilted hand? Those are the lines you just don't cross.
To me, I
And
feel that way
first
too.
of all, he should have never crossed it. And I believe it's fine because you don't insult my spouse, you don't insult my children,
Right,
and you don't insult my mother.
right.
Now,
You
you
can
may
insult me.
insult my father, but you don't insult my mama.
Wait a minute now, just a minute. Just a minute, Karen.
But and the joning that comes within a race, you are really, when you're making fun of people, and that joking, he went across the line. And to sit up there and talk and smile that this is okay, it is not okay. They said he should have waited till after the performance. But sometimes when I've gotten to that point, you with your own children, you get to that point, you're going to have to do something right then and there. And so I know I may be on the outside, but I feel that, yeah, you don't do that. And I found myself in that position. Somebody's going to insult my children, my husband in front of my face. You crazy.
This is the first time ever that I watched the Oscars all the way through. In past years, they always said that Blacks were not represented. The person who was responsible for the show, and I can't think of his name, Daniel Matt.
He was Black.
Okay. It was great. Saw the whole thing. When the smack happened, I said, was that for real? Because as it was happening and Will Smith made his comment, apparently they always say that TV is a few seconds behind or ahead. Anyway, they were able to mute it, but you could read the lips. I said, oh my God. But when Chris Rock made that comment, I really don't think he knew she had alopecia. He's a comedian. He made a joke. And the first thing he said, Jada, you know I love you, but you're going to be the next G.I. Jane 2 or something like that. It was a joke. And I really do believe that he did not realize she had alopecia. And at the same time, if you were looking at it as I was, when
Why do you think he did not realize it?
I think he might have did it for style.
He
I
knew
think
it.
he thought it was a hairstyle. But when he said that, Will Smith was laughing.
Yes.
Most others, as it was a joke, he turned to his left and saw Jada rolling her eyes. He went to commando mode. He got up and he was thumping up there.
Amen.
So,
Because he had to ride home with her.
that's
Yeah.
it.
Right.
It
That's
was like
right.
she
He
gave
had to
him the
ride home
eye.
and
He said,
sleep
I
with
better
her.
do something. And
But
that's it.
if
He
she's
laughed
a
too.
strong, if she's a strong woman, she takes care of it after the show or whatever.
No,
He
my
took
man
away.
takes care of me.
Now,
No.
yeah, well, you know,
I
that's,
see
I
what you're
mean,
saying, Carol. I see what you're saying. But he
Well, let's hear the
laughed
other
because it
side
was
of
a
it.
joke.
Yeah, you
Yeah.
laugh sometimes and then you see how your spouse or your children take it. Then you realize it's not a
And
joke.
then, exactly. Okay.
Now,
Then
I
that's
see
when he
Dr.
turned.
Callender waving. If that happened to your wife, Dr. Callender, and you have
I
to
would do
go.
the same thing.
Yeah.
Yeah.
I know how to go, man.
Except I think it was nice that he's just slapped him.
Yeah.
Yeah, because
Yeah,
a
he
regular
should've
man would
punched
have
him.
punched his lights
Punched him.
out.
Right.
yeah.
Know how.
Well, Mike Tyson's going to be hosting it next year.
Solid.
But I kind of agree.
11 o'clock Saturday.
I agree
Well,
with
did you hear
Janice.
what O.J. Simpson said?
What?
He said, had it been him walking up there, he would have been under the jail. So they gave Will Smith grace. They didn't do anything.
11 o'clock.
Yeah, yeah.
They didn't do
I
anything.
think
And they
they're
should have.
probably gonna do something to him after the fact. But my
Yeah.
thing is,
Ooh,
I won't let
don't matter.
somebody draw out
You go to time.
something in me that's not my nature.
Mm.
I'm not a violent person.
We appreciate it. She's on this line.
I can cut you with my words.
Every Thursday morning, she talk to these doctors now.
Yeah, that's
I mean, I think we could spend a lot of time on this, and I don't know how much longer you want to spend on it, doctor.
Well, actually, I was actually talking about the wisdom of somebody joking about somebody's medical condition.
yeah.
Mhm.
And that's the issue.
I kind of thought that he knew that she had somebody mentioned that maybe he didn't know.
He
But
did know.
I think he knew. But
He
my
did know.
thing, my first thoughts, because I watch the Oscars all the time, and strange things have happened on the Oscars. But this probably was one of the worst. But my thing was, like Janice said, it was Black produced. It was a beautiful affair up to that
Wonderful.
moment.
Mhm.
And I just thought it kind of put a damper on the fact that they always talked about the Blackness not being represented. And then when they went full throttle with the Blackness, this happened.
Right. So Will Smith ruined it. He did. He ruined
That
it.
was
Yeah,
my
he did.
only.
Yeah, he did.
Actually, I don't
I
agree with
agree
you.
that he-
I think Chris Rock ruined it.
Nah.
Yeah, Chris
Nah,
Rock
he-
ruined it. And
I think
that's
Chris
he
Rock,
did.
I
first
thought it was
time.
totally inappropriate to talk about somebody's wife or
My
mother.
my understanding is that Chris Rock has Asperger's,
As
and
what?
that as a child he was bullied and persecuted on one hand for being different, and on the other by being in a school of mostly white children that persecuted him for being Black. When I was in school, kids were very mean to each other. I had a friend that had was cockeyed, and they used to talk about him. I had another friend that had a withered arm. They would talk about him. Kids would talk about you terrible.
He's not a kid.
That's
Yeah.
even
I
more
understand
reason
that, but
why
what
he
I'm saying
shouldn't
is
have-
that's a learned behavior. Bullying or being bullied.
Yeah, okay.
That wasn't his first time insulting her either. And I
Any
think
other
all-
thoughts about,
What comedians do, they insult people. That's where their comedy comes from. And they've made a practice having an expert in it. For 2 years, they had Ricky Gervais, and he was like Don Nichols. Don Nichols, he was an insult comedy. He didn't have any script. What he would do is look around at people and poke at them. That was his comedy, and they had him on the Oscars for 3 or 4 years. Ricky
Yeah.
Gervais.
Yeah, that's
What about Bernie Mac? Bernie Mac would have been slapped every performance.
Mhm.
But back to alopecia, do you think this will help them to find a cure for alopecia or to do something for it? Because people have been afflicted with this for years.
For
Maybe
years.
this is a good thing because that is a debilitating, something that happens that people have, and some live with it, but it's still almost ashamed for it. So maybe the only good thing about alopecia that is being publicized, because a lot of people have never heard of it, or if they heard of it, it's just like under the rug.
And I was surprised. I thought it was well known, but I also
No, I
thought
don't
it
think
was
so.
more prevalent in blacks than whites. I don't know. But
Well, I think it's more prevalent in blacks because, well, women anyway, because of women, the admonition to have hair and the fixation on hair. We spend billions and billions and billions of dollars on hair.
Mhm.
But
Well,
I
just-
always think about India Ari sang that song, I Am Not My Hair. But tell that to somebody who doesn't have any hair.
Can I speak up there? So yeah,
Dr.
I
Callender.
think that the only good thing about this whole situation is that alopecia is becoming newsworthy, and a lot of people now know about it. And I'm sure that Chris Rock knew, and that is what comedians do. They poke fun at you. That's how they make their money. I don't even go to comedy shows anymore because I always get picked on. So, and I don't like being picked on. So I don't even go.
But they also made known yesterday that Chris Rock, Jada, and Will had an ongoing feud for years. So maybe this was intentional, another jab, because they showed
Maybe.
the last time that Chris Rock hosted the Oscars. Again, he made a comment at Jada and Will. So will we get to the bottom of it? Who knows?
I think America's turning because remember, bullying just came up, but it's always been done. Now they're saying it's something wrong with it. And people that are masculine, they're saying people are tired of being picked upon. Our comedy has to change. Us downing each other and etc. I think this is another thing for Americans and the world to know that this is unacceptable behavior. When we have to laugh at each other, you know, we even changed the words from handicap and etc. You can no longer talk about somebody that's handicapped, and they even change that terminology. And,
Mentally retarded.
and you can't say they're retarded.
That's
There's
right.
a lot of things that we're changing in our society that used to be acceptable. And we even took the rights away of people that were mentally retarded or had some physical handicap. We said they couldn't get married for fear that they would have children just like them. We took their rights away.
Eugenics.
Now, our last thing, we talked about bullying, that's a new thing. But his way of making fun of someone, that's a form of bullying and making fun. And in the schools, they're saying it's unacceptable to tease and etc. And that's all he's doing. It's our human nature way, but it has to stop.
The next article is on I suggested this because, you know, malpractice is something that occurs. And this is a case of somebody who had eye surgery for cataracts.
Mhm.
And as you know, as you age, cataracts are very common. And in this instance, the person who had the cataract surgery uh, developed blindness in the eye that was operated on because of an accident during the operation. And this is something that doesn't happen often, but accidents happen. And in this case, the accident was associated with a lawsuit because the patient got blind after the surgery. And the consequence was that the courts agreed that it was malpractice, and they decided that the person should get $1.2 million. That doesn't bring back his sight in his eye,
Mhm.
nor does it really approach the magnitude of the problem. But anyway, that's what happened. Any thoughts about this? Now it brings up the fact that humans make mistakes. Doctors make mistakes as well as other people, and this is a situation in which the doctor did make a mistake, and the mistake resulted in the patient going blind, and many thought that the doctor's response was not adequate.
Doctor, it because a operation does not turn out the way you want to, doesn't necessarily mean that it was done incorrectly. Isn't that correct?
That's generally the case, but in this case, it was directly associated with something that should not have happened.
Well, you have medical insurance though, right? That's why every doctor has to have that.
Yeah, you know, that's why it's recommended that you have it. I hope he had it. Any other comments about this case? Because malpractice is something that is here to stay. And people make mistakes. And when you talk about how to avoid malpractice suits, most people talk about the relationship between the doctor and the patient. But many are not so positive when it occurs that you go blind from something like that, or you die from something. But doctors are human, they make mistakes, and in this case, the jury felt that the doctor should pay for it.
Dr.
What are your
Callender,
thoughts?
My question is, does he also lose his license and
No.
his business?
No, he just paid the money.
I would be wondering what the percentage is on doctors. How many malpractice suits have they had in their lifetime, or if they were successful? I asked that because I had a gynecologist one time who changed her practice. She stopped delivering babies because of the malpractice fees, that the amount of money that she had to pay. I was
Right.
just wondering what the percentage is, or doctors, or if you had ever had a suit and shoot, doctor.
I've had about 3 or 4 suits, and I had one in which they found me guilty when this is interesting case, a patient who I transplanted, and the patient went to a nursing home or something like that, rehab center, and they didn't give him the medicine. That's not my fault. They didn't give him the medicine. We ordered the medicine, but they held me accountable anyway. So you never know. They can hold you accountable when it's not your fault, or they can hold you accountable when it is your fault. So having a lawsuit filed against you doesn't necessarily mean that you did something wrong. It means that the
That's
court,
true.
it means that the court found you guilty. In this case, the patient lost the kidney because she didn't get the medication that was ordered for her to be given. So you can be sued and lose your case, and the only issue is whether or not you really made a mistake. In this case, the mistake was made, but for example, in my case, I didn't make a mistake. The rehab center made a mistake and didn't give him the medicine that was ordered. But anyway, that's the way it goes. So, but the usual situation is that the best defense against malpractice is having a good doctor-patient relationship. Of course, that doesn't come into play when you actually go to a rehab center, which then is responsible for everything after that. You can't. You're not employed by them, so they are responsible.
So if doctors are perfect, there's some that make more mistakes than others. What happens to those doctors that make a whole, every time you turn around, they're making a mistake?
Well, if you make too many mistakes and you lose too many lawsuits, then you're not going to get covered, and so therefore your ability to practice and then of course when you lose a case like that, the medical board will often review your case and decide whether you were right or wrong. And so if you have too many cases like that, you can theoretically lose your license if the board agrees with the decision that the court made. So if somebody has a lot of lawsuits, it is likely that they will come before the board will review the case and decide on the merits, whether you are making many mistakes or not. And on the board, there are consumers as well as doctors who make a decision as to whether you should lose your license or not.
Is it true that you have to have money to sue?
No, because many attorneys will take a case with the presumption that they will get paid after you win the case.
Like those ones that advertise on TV.
Yeah,
Right.
that's right. That's right.
Dr. Anto has his hand up.
Yes. Good morning, everybody.
Hey, Doc.
Hi.
Yes. How soon can a patient determine or detect that the fault of the cataract surgery was due to the negligence of the eye doctor? How soon?
Well, if you go blind, that's as soon as you go blind, you can sue, or as soon as you detect that anything is wrong, you can sue. Now there is a limitation on how long you can wait before you sue, and in some instances, if you wait longer than a couple of years, then you lose the right to sue. But you can sue as soon as you want to sue. The only problem is if you wait too long to sue, in which case the statute of limitations may run out on you.
How long is too? 1 year, 2 years?
I think limitation is 2 years for some instances, and a lot of it depends upon when you discover the problem. So from the time of discovery till the time you sue, in some instances can be 2 to 5 years.
Okay.
But it has to be related to the time you discover the problem.
Dr. Callender, I hear also sometimes on commercials that they want mothers to sue because of birth defects of their children. And I'm not quite comprehending, what does a doctor have to do with a birth defect of a child?
It doesn't really matter whether, in other words, people can sue for legitimate reasons and for illegitimate reasons. And so they can sue for something that's congenital. Whether they win or not depends upon whether it is truly congenital and related to practices that occurred during the delivery or before the delivery or anything like that. So what I'm saying is that you can sue for something that's legitimate or something that's illegitimate. Something that's your fault or something not your fault. So you can sue. Whether you win or not is determined by the judge in some cases, and in some cases by the jury.
You know, I just saw that commercial this morning, Carol. And I thought the same thing. It was a Black woman talking about she was expecting her child, and then all of a sudden they discovered some kind of birth defect. I'm saying, wow, how can she sue the doctor for her child having a birth defect?
They can and do. And nowadays you have the phenomenon called pre-diagnosis, where they can do genetic diagnosis in utero and make a diagnosis. So, but you have to pay for that to be done, so that they can make a diagnosis before the delivery. But if you don't do that, then they may have no way of knowing that you have a. But I think that's maybe the basis for some people suing, because they couldn't afford to get pre-delivery diagnosis of genetic disorders.
So they got a pre.
I had a question for Mariana. Your doctor that stopped delivering babies, she didn't go out of business. She just started doing something else.
Right, and there are many doctors who do that.
Yes,
Many
she
doctors who do
stopped.
that.
And she told us that she stopped because of the high price of malpractice insurance.
And many OB doctors have done that for that same reason.
So what other practice did she start up?
Gynecology.
No,
Yeah.
I'm talking about, did she?
Well, this doctor went into, you know how they have doctors that examine your cases when you're going for a workman comp.
Yeah.
She went and worked for the police medical board or something like that.
Okay, that's my answer. Thank you.
And many other obstetrician gynecologists, they just stop delivering babies and do GYN work, which is
right. You
they
could
do
do
GYN surgery, so that they just stop delivering babies. But as you mentioned, there are other things you can do other than deliver babies. So you can be on boards and do a lot of other things. Because the malpractice premiums were very high for people who deliver babies.
So our society, they blame doctors and teachers for their children.
As much as $100,000 for some malpractice insurance.
Oh.
Dr. Callender, did I understand you to say that doctors don't have to have malpractice?
In most hospitals, doctors are required to have malpractice insurance.
Okay.
Now in your office, that's different, but if you work in a hospital, most hospitals require you to have $1 million to $3 million of malpractice insurance.
How much you have to pay a year for this insurance?
It depends what field you're in. In OB, that may be as much as $100,000. In other fields like surgery, it's more likely to be like $5,000 or something like that. I think obstetrics was the highest one because People want their babies to be perfect, right?
So, excuse me. So the private practitioners, they are not required to have insurance. Malpractice insurance?
No, if if you're a private practitioner in an office and you do not work in a hospital, you're not required to have malpractice insurance. But it's the hospitals that require you to have a malpractice insurance if you go practice in their hospital, if you have patients in their hospital.
Okay.
But if you have an office and don't do hospital work, you're not required to have malpractice insurance.
So can a doctor refuse a patient because it looks like this patient's gonna sue them? And they're just to say, I don't want to be bothered with you?
The doctor has a right to accept the patient or not accept the patient.
Oh.
You know, Dr. Callender, I would think that the patients of psychiatrists can't sue.
Why would you say that? Any patient can sue.
Because how can you prove that it was malpractice?
Listen, malpractice is determined by the judge or the jury. So they can determine it by whatever means they decide they want to. And that's why people sue, because you never know what the judge is going to say, and you don't know what the jury is going to decide.
Yeah, I was just thinking that a person who had severe psychiatric problems, couldn't sue because it would be hard to prove that it was the psychiatrist's fault for the patient's problems.
You're right, it is true. That is true, but you can still sue.
But see, you wouldn't be suing because of their psychiatric problem. You probably would be suing because maybe the doctor we had one here in DC where a psychiatrist got sued and because he influenced the patient and had a sexual relationship with a patient. So it wasn't because he took advantage of the person because the person was mentally ill, but it wasn't because he had done anything to increase the mental illness, but that he had taken advantage of somebody that had mental illness.
Yeah, there's so many different reasons people can be sued. So all you have to do is want to sue. You don't have to have a legitimate reason. You just sue.
Yeah, I have one more question. With regard to this cataract surgery, do you have to rely on your intuition and instinct, or on the eye doctor's recommendation, or both, before you elect, to do this surgery?
Usually you rely on you have the opportunity to select any doctor that you want, and you have the opportunity to investigate their past history. And then after you do that, you decide on who's going to do your surgery or who's going to take care of you. If you're not satisfied with whatever happens, then that is when people usually decide that they're going to sue. Does that answer your question, or?
No, I mean, before you elect to do the surgery, do you rely on the eye doctor's recommendation or on your intuition? Because, some of
That's
us—
up to you. That's up to you.
Okay.
The patient has to make that decision
Okay.
in terms of whether they want to rely on their intuition or they want to rely on what the doctor says. And I think autonomy is the right for the patient to make a decision one way or the other based upon whatever they choose to use, whether they want to use intuition, whether they want to use recommendations from other patients or the doctors.
Okay. Because some doctors, they keep on pressuring somebody that, you have to do this surgery, you have to do this surgery, you have to. But
Get a
for
second
instance,
opinion.
with this cataract, oh, you can't see, but you can see. You begin to wonder in yourself whether the doctor is inside your body. So that's why I'm asking this question: whether you have to follow their advice or follow
No,
your intuition.
no, you don't have to follow anybody's advice. It's up to you. You can follow their advice or not. That's your
Okay.
option.
Yeah, but Dr.
Autonomy means that you have the right to accept the doctor's recommendation or go
Yeah.
to another doctor.
Yeah, but in this case, I was getting ready to say a second opinion would be
Yeah.
very valuable. Second opinion.
Yes.
Good advice, right?
Dr. Ock, your comment about relationship with patient is very valid because sometimes you have an outcome that is not favorable. But if you realize and you feel that your doctor did the best that he could, then you will not sue where you might have sued and won money. But
That's correct.
if you feel that you had that the doctor did his best, then you wouldn't.
That's what most people believe, that
Right.
the doctor-patient relationship is what
I believe that too. I
yeah,
believe that.
what makes a difference. Now, for those who have hearing impediments, this is an article that tries to link hearing problems to COVID vaccines. And these are rare reports, but the reports nonetheless. So out of more than 11 billion doses, 367 cases of tinnitus and hearing loss. So that's, wow, that's rare. So extremely rare, but they do occur. And I mean, to have that small number in 11 billion is pretty rare, but it's tinnitus is something that Janice knows a lot about, and it's not fun, but it is something that can occur.
Right.
And they would say there's no causal relationship.
Yeah, I was wondering the same thing. How could they decide that these people weren't going to have the tinnitus anyway?
Right. I mean, that's so rare, 100 out of 11 billion. It's tough to, yeah. Anyway.
I love this one. I love it. Ladies in the house should have done it a long time ago.
Yes.
Yes.
That's the one I saw. I saw that article about that over in Europe. And I said to myself that if men had to have breast exams like we do, they would have been doing that years ago.
They do have breast exams, and that's not true. Men are having breast exams.
But men don't have them every week. They don't have
They don't have mammograms.
time
No,
because
they don't. What you mean to say is they don't have mammograms.
No,
men or women. Men or women. It's great.
We do have breast exams, but we don't have
their breast.
mammograms.
Right. Exactly.
I thought what she was saying is that if men had to have them as frequently as women, they would have invented this machine a long time ago.
No, what I'm saying is that machine has been invented, but what I'm saying is that what is different?
Why hasn't it been over here then?
What is different in men is that they have breast exams, but they don't have to have the mammograms, which is very uncomfortable. But they don't have to have those.
Right.
And that's the difference. And I think what you mean, if men were required to have mammograms, things would be different, and that may be true.
Yeah,
that is true.
So is that machine here in America?
3D, well, they're Johns Hopkins is the one that is now actually doing that. Yes.
So I got to go all the way to Johns Hopkins.
That's the only one that's doing it so far, right?
Yeah, we need to push for that.
It's almost worth it, isn't it, Carol?
Oh, yes, indeed.
Yeah.
Just lay down and don't
Yes.
pushing and shoving and pinching,
Mashing.
mashing.
I will
I
agree with
usually
that
feel like
also.
I need a drink after I finish.
Right.
Well, I
Take
think
me
you
out
make
of
a point.
here.
I think your comments are very appropriate.
Well, men don't have
I'm that though. I
mammograms,
do it every year.
but men have prostate exams, the digital exams. They're uncomfortable as well.
It's not uncomfortable, it hurts.
Right, right. We ain't
It
talking about
hurts.
uncomfortable.
You're not talking about being uncomfortable. I'm talking about it hurts.
Yeah.
There's a degree of pain associated with the size of the doctor's hands.
Yes, that's why I
No, with the
selected
This is a
size of that
huge
female
machine.
neurologist.
This is a huge machine.
that's squeezing your breath.
Mashing.
Yeah,
He
that's
doesn't
what all
squeeze his
every
crush.
woman I've encountered says the same thing you said. Exactly the same. My wife.
I'm a
says the same
very
thing.
passive person, but I'm fired up when I come out of there.
Mhm.
Yeah. Okay.
Well, I don't really pay much attention to women complaining about mammograms because they live so much longer than men. So it's all good.
No.
Oh,
That's the
Darryl,
price we
What,
pay.
Darryl?
That's the price we pay.
That's the price you pay. Get over it.
Okay.
Deal with it.
Oh my
No,
goodness.
no.
Oh wow.
Darryl is back.
Mm.
How about giving birth? What about that price?
Well, I think
Thank
it's a
you.
good idea to
Thank
change
you
the
very
subject.
much.
Maybe. Maybe a good idea
Not
to change
good
the subject.
enough.
Yeah.
Maybe a good idea to change the subject.
Yeah.
Harassment of public health workers widespread during pandemic. And this is interesting because you can't take it out on the disease, so you take it out on the healthcare professionals, and that's like when the doctor tells you have a disease, you don't take it out on the doctor. You blame God for it. So.
well, if you got a spouse, you blame them too.
I'm not familiar with that one. Really?
Oh,
Well,
okay.
I'm getting ready to harass some healthcare workers because I'm gonna try and see if I can get that next vaccine.
Do like John Buchanan did.
I'm gonna do it in a very nice way. I have my ways.
Okay.
You're gonna have to have a referral though. Until the FDA approves.
FDA has now approved it. They just approved it.
I'll see how long that takes. If it takes too long, then I'll go ahead and
No, they
start
just
my
approved it.
mission.
I think one of the articles I sent said that.
They approved it one day this week.
Now this is the BA2 is the latest variant, and the question is this going to be something to worry about? And the answer is that if you're fully vaccinated, it's not likely to cause hospitalization or death because the vaccine will protect you. But if you're not vaccinated, then you should be concerned about it. It's more transmissible, but it's not any more lethal. But if you are fully vaccinated, then it does appear as though you don't have to worry about it. But there's so many unvaccinated. Only 62% of the country is vaccinated.
That's outrageous.
Which means it's more than 30% population is unvaccinated. And so this then means that we'll have an uptake in the number of COVID infections. But it's good to know that the vaccination process is effective. Now, this is the article that I was talking about that indicates the FDA has approved it now. And so if you're over 50, then you can get a shot. And of course, if you're immunosuppressed, but as long as you're over 50 now, you should be able to get a booster shot.
Yeah, I'm gonna start
No
working.
question, no question about if you're immunosuppressed. But if you're over 50, FDA has cleared it so for you to get it.
Good.
They'd asked for 65 and over, they gave them 50 and over. So it's now approved.
Might be a good thing to get it as soon as possible. I heard them talking about the funding running out for it being paid for.
Yeah.
In some
That's
cases,
correct.
so,
Yeah, we
Right.
discussed that last week
yeah.
about the lack of funding for
Mhm.
testing as well as
Mhm.
vaccinations.
I think they
Plenty
said
of money for bombs and war, though.
totally different.
Well, yeah, yesterday they did approve, yeah, but not for the, they declined to approve the.
Isn't that something?
Yeah.
Does that surprise anybody? No.
No,
No, no.
no.
Now, what is interesting is that there's also the flu season is on us as well. And this talks about the efficacy of the fourth dose against Omicron, and it's demonstrated that it is effective. And I think this will be the last article. It's 10:30.
Can you enlarge that graph? John?
No. Yeah, the quality of it won't get any better if I make it bigger. It's
Okay.
out of focus.
Oh,
The bottom line is that yes, the vaccine is effective in terms of protecting you against Omicron. The question is whether it's 85% or 90%, but it is effective.
What does that efficacious mean, Doc?
Oh, it means works. It means effect. It means that it works,
It's-
particularly against symptomatic disease, which is something that you've mentioned before, that some people will become positive, but will have no symptoms because the vaccine is preventing you from getting severe disease. So asymptomatic disease means that you have no signs or symptoms. Any other comments or questions? It's been an interesting session with a lot of controversial aspects of it. Any closing comments? Kevin,
I have
anything?
one, Dr. Callender.
I have
On
one.
this date, in March 31st, I had a baby brother that was born in Indianapolis, Indiana, 1 month after my mother moved back and father moved back from Los Angeles, California. None other than the great Darryl Armistead. Happy birthday.
Happy birthday, Dad.
Since you're congratulating people, you might as well congratulate my husband and I on our 32nd wedding anniversary, which is also today.
Congratulations.
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 Cool, cool.
Okay. Any
And
other?
One last comment. Does anybody think that Will Smith could have just stood up and shouted, "Hey man, my wife is off limits."
Well, I will say, while we were Zooming, a news report came on. If anyone is interested, I know we beat this dead horse. The Academy said they did ask Will to leave. And all of that crying wasn't about he was sorry for hitting Chris. It was the fact that they were trying to get him out of there. And I think that's when the piece came through with Tyler Perry, and Denzel pulled him off to the side and was talking to him, but he refused to leave. So I guess today, later on in the news, we'll hear more about that.
Okay.
But I'm
Anyway,
grateful
I
that something else to talk
I thought it was a
about.
good slap, but it's not the Christian thing to do.
Right.
No, it's not.
It's not the
Right.
Christian thing to do.
What
But
is it? Talking about your wife or hitting?
But
Hitting
no,
somebody,
no,
using violence.
slapping. You're supposed
I
to
didn't
turn the other
realize
cheek.
I had a gangster cousin.
But you
You're
don't
supposed-
talk about, you don't denigrate people either. That's against the
agree.
law too. That's
Two wrongs don't make a right, but
No,
You
no.
didn't answer the question. Couldn't he have stood up and just shouted, "Hey man, my
Yes,
wife
he
is
could
off
have.
limits.
Yes,
No.
he
Right.
could have.
yeah,
That's
My
a better
wife is
way.
off limits."
he
Yes.
deserves a slap. He
Well,
deserves a slap.
there's
As
the
far as
old
I'm
saying,
concerned,
walk a
he
mile
deserves
in
a
my
slap.
shoes. We can talk about what another person does that may not necessarily be the best way to handle a situation, but you really don't know how it would affect you until you
That's
are
right.
up against that same
That's
wall.
right.
So, because let me tell you, if anybody says anything about Christopher John Burnett, they do not want to see the wrath of Bonnie Burnett.
All you're saying
And
is that
and I'm just being honest.
all you're saying is that people snap. People
Yeah,
snap.
you can lose it. No one is beyond losing it.
That's correct.
No, they're not.
Take a lesson from Jesus when they were misusing the temple and selling stuff. Yeah, what did he do? He pulled that rope from around his.
He lost it.
That's right. Tell it, John.
Well, with that, we'll close, remembering that Jesus did say to turn the other cheek.
Yeah, he did. Yes, he did. Yes,
yeah,
he
but that's
did.
a hard thing to do.
It is.
Didn't do that.
And I wouldn't want anybody talking about my children or my wife. So
There you go.
yeah.
And John, I expect
Talk
you to
about
come
me.
up and defend
Talk about me,
me.
it's okay.
Walk up there and
Not-
hit him.
Not my
I'm
wife.
telling my
like
wife
that.
is talking about my wife is off limits.
Absolutely. Talking about my children, it's also also.
So you say you wouldn't slap him, you'd punch him.
No, I slap them because they're not gonna put you in jail too much for slapping. They will for punching. You might break bones or something.
Okay.
They're both assault and battery though.
Yeah, it is. Yeah, it
That's
is.
right.
Right.
That's right.
He
Right.
said he wasn't gonna
But
press
he-
charges though.
He so far
No,
he has.
because he's a comedian. He knows he does risky stuff.
Mhm.
That ain't his first time with somebody coming up to him and doing something. Most
he-
of them will tell you they've had all kinds of altercations with fans over the years.
And he's got malpractice insurance too.
Yeah, I was just thinking about the Academy should have some insurance
Yeah.
on Chris Rock for hosting the thing.
Chris
wasn't
Rock has
hosting,
insurance.
They say his ticket sales have gone through the roof.
Through the roof. Yeah.
He's getting
And
ready
the
to go.
first
He
one
just
was like,
started on tour.
so I'm
Ticket
sure we're
sales for
here.
what? Ticket sales for what?
He
His
has a
performance.
tour, a comedy tour.
In
Oh.
Boston,
started
Will
last
Smith. We're
night.
talking about Chris Rock.
Oh, so he's
Yeah,
loving. He's
start
loving it.
last-
then.
Yeah, he's
All the
loving
people who have alopecia, look out,
it.
look out.
That's ridiculous.
They tried to say when it first happened that he was having a breakdown, that's what the reports first came out right after the Oscars went off. They were saying that Will Smith just had a meltdown, a breakdown, and he needed to see somebody.
He had a breakdown
Whoa.
called Jada Pinkett.
That could be true.
Yeah. Mhm.
Okay, well, everybody
His
have a good.
wife be selling wolf tickets, telling all his business. That's part of his problem.
Anyway, have a nice
Oh,
week.
Lord.
See you
Okay.
guys.
Good
Bye.
night, Dr. Callender. Thank you very much.
Happy
Be safe.
birthday,
Thank
Darryl.
you. Goodbye.
Be safe.
Happy
birthday,
Have a
birthday,
great
Darryl.
day, everyone.
Happy
Happy
anniversary, Betty and Charles.
Thank
you.
you.
Thanks,
Bye.
Dr. Atal, for being
Oh,
with
let me
us
turn
again.
off the tape.
Yeah, thank you, Doctor.
Bye.
Thank you.
Thank
All
you.
right.
Bye-bye.
Bye-bye.
This is Dr. Atta.
Yes. Take care. Bye-bye.
Yeah, let me turn off this tape.
See you later.
Yeah, Dr. Atta, they were talking about smoking earlier before you got on.
Oh, yeah. I
Yeah.
saw that.
What? Give me some highlights on that.
They said stop.
I'll try.
We were talking about how difficult it is to stop. I for 40 years.
Yes.
I'm going
And the
down.
only thing that got me to stop was Wellbutrin.
Oh, that's what she said.
It's actually an antidepressant. And I took it for 10 days. And then it started making me want cigarettes less and less until I didn't want them anymore. But the
Oh.
most important thing that the Wellbutrin did was took it out of my mind, because cigarettes are in your mind,
Correct.
not just in your blood.
That's true. That's quite true. I agree with that.
And after I had a meal, I wanted a cigarette. If I
Yes.
had a drink, I wanted a cigarette.
Yes.
I get up in the morning, I want a cigarette.
Yes.
And,
It's in your-
and the Wellbutrin took the want out of me.
Yes.
And worked very well.
I agree with you totally. Good.
So I know how to, I never stuck any other way except for that medication. And it didn't, it kind of made me feel a little jittery, but
Okay.
I powered through the jitters, and in 10 days I stopped smoking
Okay.
after
Good.
40 years of smoking. And it's been 11 years since I took the medicine, and I haven't wanted a cigarette. I can see somebody smoking, I can smell smoke, I can drink, I can eat, and I don't think about a cigarette. And that's the difference in the medication.
Yes. Is it a prescription?
As opposed to other methods to stop.
Okay.
Is it a prescription?
Yes.
Okay. Okay. What's the name again?
Wellbutrin.
Okay. WELL.
B-U-R-A.
TRIN.
I think it's Wellbutrin.
Okay. Thank you. Okay, I got it.
TRN. And it's an antidepressant.
Okay. Okay.
Now I had to lie and say I was depressed to get it.
Oh.
You know how your doctor asks you if you're depressed?
Yeah, yes.
Well, I had to lie and say I was depressed, but I got a prescription for it, and it worked.
Okay.
Because the insurance companies don't want to pay for it.
Okay.
But I had a friend that bought it. She got a prescription, and insurance didn't pay for it. It cost $65, but she only needed 1 month.
Okay.
And she stopped in about 2 or 3 weeks.
Okay. Okay.
But it's worth a try.
In a way, Marilyn, you didn't lie, because it is a very depressing thing to be, we can't quit smoking.
Well, at one time it was accepted, John. At one time there were ashtrays everywhere. You could get an ashtray in a elevator, ashtrays on a telephone. I remember a doctor smoking, talking to me in his office. I had a smoking room at a company that I worked for. Everybody's house had ashtrays. It wasn't. You weren't a pariah. It was you saw people smoking on TV.
Yes.
So once people learned the danger of it and the worst part of it, then people were very judgmental and very cruel to people that smoked. And they people would get very sanctimonious, and they'd be, they say, "Oh, you're I would be like, that would be enough to make me want to punch somebody, because you'd being unkind. When you're smoking a cigarette, you're smoking it more because of the want and the want and the need, not because you want to, because you're addicted to it.
Yes.
You can't stop.
It's an
And
addiction.
people didn't understand that, and they were cruel to me. And I got to the point where most of my friends were smokers. And if you didn't smoke, I was giving you the side eye.
Yes.
On the other hand, Dr. Atto, we talked about coffee is good for you.
No, I drink tea.
Yeah. Oh, you drink tea? Okay.
Yeah, I don't drink coffee.
Okay. They
I
said
drink-
coffee was good for you because
I
it
drink-
opens up the arteries around your heart.
Yeah, I drink tea with lemon and
Honey.
a little honey and ginger every day, every morning.
And we talked about sugar too today.
I don't eat too much sugary
Sugar
things.
substitutes.
We talked about sugar substitutes.
Yeah,
Artificial.
saccharin, yes, and the rest.
Coffee works as a laxative to me, John.
Mm-hmm.
Yeah, and then the thing about the sucrin and all those, they say there is a risk of cancer.
Yes, yes.
Mm-hmm. But anyway,
Yeah.
I'm glad you could get on today.
Yeah, thank you very much. Thank you. I enjoyed it.
All right, I'll see y'all later.
Hey, John.
Yes, ma'am.
John.
Yes.
Do you? I don't know if you've heard, but Rhoda's mother passed away. Rhoda McLeese Smith.
No.
You know Rhoda?
No.
Yes, you do. You played for us. She's the girl from the DC Autistic Society.
Oh, okay. Okay.
Your wife is gone.
Yeah, she's gone.
Yeah, she knows Rhoda. She's the one that hired you all a few times to play for the Autistic Society. But her mother passed away on Monday.
Okay. Yeah, Carol's on the other phone.
I'm gonna call Carol and tell her.
She's on the other line, as you probably thought. She went
Yeah,
right to the phone after she got off.
But I'll get to talk to her. But I had forgot to say anything about it. But you know what, John, I do when I go to see a new doctor, I reach out my hand to touch. If the doctor's hand, I reach out to touch him. If he pulls his hand away, then I don't see him. Because if I can't touch you, you can't touch me. And that's how I tell real from fake.
There you go.
Okay.
So, Dr. Atto, you need a second opinion.
For my
we always talk about
for the
getting a second opinion.
Yes.
Yep.
Yes.
Okay, I'm out of here, y'all.
Thank you very much.
Okay. All right. See you now, John.
All right.
Thank you.